This is One-on-One. Hi, Steve Adubato. We're here at Princeton University's Woodrow Wilson School. This is a very important conference. It's the conference on big data and the implications for healthcare in the state of New Jersey. We're honored to have the Commissioner of Health and Senior Services, Mary O'Dowd, with us. How are you doing?
Good. How are you?
Doing great. So we're here at Princeton.
We are.
This is great.
It is.
You just spoke to this conference and you shared with them an important message. What was it?
Well, one of the things that I'm here to talk about is what the Department of Health, on behalf of the state of New Jersey, has done to invest in health information technology. And there are two main areas. One is around clinical data, and that's really helping our hospitals, physician offices, and all the traditional healthcare providers invest and benefit from health information technology and share it amongst themselves. We've helped them build a system of regional health information organizations where they can share data amongst themselves for their community. And we're also building a health information network, which is the highway that allows these organizations to share data statewide amongst each other.
Commissioner, break that down for examples. People can say, that sounds fascinating,
right?
But what does it mean to me?
So what it means to you is, if you are a patient who shows up in an emergency department in one area of the state, but yet you have providers in other areas that treat you regularly, this would allow that emergency room to reach out to their health information organization to say, I have Steve in my ER right now. Can you find out if he's been to the hospital anywhere else recently or at the physician office?
You can find that out?
They can reach out and share amongst the network that we've built for them to find that out. Now, we're in the beginning stages, so we've just
New Jersey is.
New Jersey. Many of the regional health information organizations can already do this regularly, but what we're building, where we are in the beginning stages, is actually allowing Camden to communicate with Newark, letting Trenton communicate with Summit, so that they're talking to each other, even though they're not in the same local region.
So, Commissioner, let me ask you this. So, we talked to your colleague in New York State.
Yes, Nurav.
He was talking about what they're doing, and they seem, frankly, further ahead than we are. Is that a fair assessment?
I don't know.
I like that answer.
I don't know.
But he made it sound like they're doing certain things.
Which kind of things?
Well, he talked about the technology that they're using, and he talked about the challenges they face as well. What would you say a challenge we face in New Jersey is that is unique to our culture, if you will, when it comes to information technology and healthcare?
I would say that one of the challenges that we've experienced is that we have a lot of competition amongst our healthcar providers. Now, I don't know if that's unique. I don't know that that is unique. I mean, I've noticed that there's some competition amongst New York providers as well.
Yes.
But I think that one of the really important hurdles that the providers have to get over is that they have to collaborate together. And this gets to another point of mine, which is the public health side of sharing data. I presented today some of the reports that we've put out that show the opportunity to improve our community's health, preventable hospitalizations. How many times?
Preventable hospitalization.
Right.
For example?
So, for example, someone who, if they manage their diabetes a little bit better, they wouldn't have to go to the emergency room and potentially into the hospital as an inpatient. So resetting the bar, allowing an understanding how to invest in preventive primary care to avoid more serious complications and hospitalizations for patients. We have 3 areas of our state that are working and have been nationally recognized for the work they're doing to collaborate. Jeff Brenner in Camden, the Trenton Health team in Trenton,
doing great work.
And our Newark team as well, all working together to try to build a system of sharing data to better manage care. Often we're talking about just the healthcare setting, so the doctor's office, the hospital, but on the public health side, we put out a report and shared data
on... The department did?
Correct. Allowing individuals to see on a regional level, what are the diseases that patients could be treated for better in the community, but are not necessarily getting the support they need and are ending up in the hospital. And that's an opportunity for us to really share data in an effective way from a public health perspective and a healthcare perspective to really raise the bar and improve the health for our community.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Felician College, Health Republic, Insurance of New Jersey, Qualcare Inc., Johnson & Johnson, NJM, New Jersey Sharing Network, and by Choose New Jersey. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.